Hello and welcome to Module 3 of the Rural and Frontier Local Board of Health New Member Toolkit. If you haven't already done so, please be sure to review Modules 1 and 2. Again, my name is Valerie Quape, presenting on behalf of the University of Nevada, Reno, and the Nevada Public Health Training Center. Today, we're going to be discussing statewide public health systems, and more specifically, Nevada's system as it relates to rural and frontier counties. Today's content will be addressing the following learning objectives. First, we will discuss how public health systems may vary among different states, as well as what Nevada's public health system looks like and how local Board of Health members fit into that system. The Association of State and Territorial Health Officials, abbreviated to ASTHO, produces regular reports that survey how different states function with or without local health organizations. ASTHO then categorizes states based on their degree of centralization, which is based on how much authority is granted to local governmental health agencies versus keeping that authority centralized to the state health agency. Please note that when we're talking about agencies, we're talking about a health department rather than boards themselves. Here we can see a broad range of categories into which a state system may fall. These categories range from completely centralized systems with the least amount of local control, all the way to completely decentralized systems with the most local control. Let's explore how that actually looks when we compare centralized systems versus decentralized systems. In the case of a centralized system, the state health department is the only governmental agency within the state that holds public health authority over its jurisdiction. All public health offices in different locations are actually branches of the state agency itself, rather than being part of city or county government. While local governments may have some ability to negotiate services provided to their communities, all services are applied for, managed, and implemented by the state health agency itself. Conversely, in a completely decentralized system, the state is broken into local jurisdictions. These jurisdictions most often consist of either single counties or, in more rural areas, regions that include several similar counties. The state public health agency then delegates authority to the offices of local government that oversee those jurisdictions. In decentralized systems, each jurisdiction would have its own public health agency, which provides public health services to the community and then reports to local government officials. This establishes a higher level of local control over the public health services provided to their communities. So, which type of system is the most common, and where does Nevada fit? As you can see, most states are completely decentralized systems, while others are distributed among the other categories. Nevada and Texas are the only two states who have been categorized as largely decentralized state systems. But what does that mean? While a completely decentralized system breaks the entire state into jurisdictions that are under local control, a largely decentralized system breaks down jurisdictions based on population size, with local control in the more highly populated areas of the state and the maintenance of state control in the rural or frontier areas. In order to be categorized as largely decentralized, more than 75% of the state's total population is located in areas that are under local control rather than that of the state. In Nevada, the Division of Public and Behavioral Health, or DPBH, is the state public health agency. DPBH has delegated authority to 3 local public health agencies: Carson City Health and Human Services, or CCHHS, Washoe County Health District, abbreviated to WCHD, and Southern Nevada Health District, or SNHD. These 3 agencies have direct jurisdiction over the consolidated municipality of Carson City, Washoe County, and Clark County, respectively. Thus, they have jurisdiction of over more than 90% of Nevada's total population. The remaining 10% of the population is served directly by DPBH and mirrors a centralized structure. All public health offices in these remaining counties are not run by local government, but are satellite offices of DPBH. It should be noted that this much smaller portion of the population is spread out over 14 geographically large counties, which can create additional challenges in the provision of high-quality services. So, if the state has jurisdiction over the rural and frontier counties, where do local boards of health in these communities fit? Let's take a closer look. In rural and frontier parts of the state, since the structure excludes a local health department, the state-level public health agency and the local board of health work together to provide local public health services. In systems such as these, it is even more crucial that the local Board of Health voices the needs of the community to the state health agency and any other agency that is contracted to provide public health services within their jurisdiction. In Nevada's rural and frontier counties, as in centralized systems across the U.S., the state public health department will provide typical public health services such as restaurant inspections, disease investigations, or others, but it is often a network of community organizations that may provide the programs and services more commonly associated with community health, such as health education, tobacco use prevention programs, immunizations, maternal and child health care services, and physical activity or nutrition programs, just to name a few. Here, the local Board of Health works with both the state health agency and local organizations to make sure the community's public health needs are being met. We will discuss the types of agencies that may be involved in these community-wide public health systems in Module 4. Okay, let's review what we've covered in Module 3. Nevada is one of 2 states in the entire U.S. which has been categorized as largely decentralized by the Association of State and Territorial Health Officials. What this means is that over 75% of the state's population falls within the jurisdiction of local government public health agencies. The role of local boards of health is to work as a connector between a state board of health or state public health agency and to work with local level agencies to identify the community's public health needs. This role is even more critical in Nevada's rural and frontier counties that do not have a formal local health department. Here, boards must connect local nonprofit, healthcare, local government, and non-governmental agencies together to implement coordinated solutions to the community's public health needs. This might include working with organizations outside of the board's jurisdictions to share resources or even just information about what has worked for other communities. Thank you for completing Module 3. Be sure to view Module 4, where we will identify the different types of organizations that make up the public health system at the local level and give examples as to how local boards of health may partner with these organizations to address problems in their community. Module 5 will review how Nevada revised statute dictates the powers and authorities of local boards of health. And finally, Modules 6 through 9 will discuss ways that local boards can work with community groups and outside organizations to address issues that are faced by their constituents. This includes engaging in community health assessment, multi-sectoral improvement planning processes, building and implementing a board-level strategic plan, and ways to include quality improvement and program evaluation methods into their plans to improve efficiency and effectiveness. Thank you again for your participation in Module 3. If you have any further questions or comments about the content of this toolkit, please contact the Nevada Public Health Training Center at the email address provided above.